Understanding and being mindful of our sexual health is essential for overall wellness. And here to guide us through the key aspects of sexual health awareness, making sure that we prioritize our well-being this Pride Month, is Nurse Jake. Welcome back.
Yeah, thanks for having me back.
We get to talk to you about all things, and I love this so much. Let's start with the basics. First of all, what is sexual health?
Yeah, so sexual health is going to be dependent on the individual, so it will vary. But essentially, it's being as healthy as possible and having as satisfying as possible relationships. And Anne-Marie, it's not just about your health, it's about the health of your sexual partner or partners. So it encompasses body, mind, emotion. And there's really two important considerations to achieving optimal sexual health. And that's first, that Canadians have access to education and information so they can make informed decisions, but also that they have stigma-free healthcare services available to them should consequences or issues arise. And
we just had on Chief Medical Officer from Casey Health, Ed Kucharski, and he was talking about that, about removing stigma even within healthcare so that people get adequate care.
Yeah, very important, so that people feel comfortable accessing it and then can address those issues.
So why is it especially important that we're having this conversation in June during Pride Month?
Yeah, glad you asked. So your sexual health, regardless of how you identify sexually, is important and is at risk if you're sexually active. But more so for the 2S LGBTQ+ community, there's a couple of factors. So the first is that within the community, there's a higher prevalence of STIs, viruses, for example, HIV, which Casey House helps with, or with things like monkeypox when that was a big issue. And that's because it's inherent in the sexual practices for men who have sex with men or anyone who engages in anal sex. The epithelial lining of the anal canal is a lot thinner, so you're more at risk of tearing, which could lead to infection. The second thing, like we just talked about, is that there's a lot of stigma that exists for our community, so that prohibits people from accessing services. So if we're not accessing services, then things are going underdiagnosed, we're going to be underreporting, and then there's going to be a higher prevalence. So it's so crucial.
Preventative care.
Yeah, so it's so crucial that people are seeking preventative care, and that if you are a member of the 2S LGBTQ+ community, you're going for regular health checkups to stay as healthy as possible.
How do we stay safe and healthy at the same time? Because those two things go hand in hand.
The first thing, the most important thing, Anne-Marie, is know your health status. So you really want to think, when was the last time that I was screened for anything related to my sexual health? How many sexual partners have I had in that time? How many sexual partners will I have, or how frequent am I engaging in sexual activities? And how you answer those questions will depend, and it will dictate when you should get screened. But as healthcare professionals, we recommend that if you have multiple sexual partners, you're getting screened at least every 3 to 6 months.
Every 3 to 6 months. Yes. Again, why it's important to have stigma-free healthcare,
so people
feel comfortable. That's right. How do you know if a preventative medication like PrEP is right for you?
Yeah, so let's talk about what PrEP is. So PrEP is pre-exposure prophylaxis. It's a medication or a pill that you can take once a day to help prevent acquiring new HIV infection. And it's right for certain people. For example, if you have multiple sexual partners, like we just talked about, it might be a medication for you. If you're in a serodiscordant relationship or a mixed status relationship, which means one individual is HIV negative and one is HIV positive, it could be a medication that you use. Or if you're engaging in sexual practices without using a condom, then this medication's right for you. But at the end of the day, we recommend that you speak to your healthcare professional, so your NP, your medical doctor, to determine based on your health history and your sexual health practices if it's a medication you should be taking.
It's an important conversation, Jake. I'm glad that you were here to have it with us.
Thank you.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.